Hi there. Do you feel like anything you eat gives you bloating or makes you gain weight? Don't worry. This is a very common thing for women as they get older. And this isn't the only thing that happens. I hear it all the time. Dr. Sarah, I can just tell that something is off. Nothing seems right. I can't sleep. I'm so irritable with my partner. I can't tolerate my children. I wake up and have anxiety for no reason. And I have gained weight, even though I diet. I simply breathe and gain weight. It's practically a full-time job to get enough protein in and not gain a pound. Not sleeping and gaining weight are huge for me. But I also feel exhausted at night, and it seems like I can't focus in the afternoon, and I have no motivation. I'm only 39, so I went to my OB-GYN, and they said that my labs look great, normal. And since my periods are regular each month, it's not my hormones. Man, if I had a nickel for every time I heard this story, I would own 4 Ferraris. Stick around and I will give you a way to fix all of this that will literally take you 10 seconds a day, and you don't have to change anything else. Plus, you can get the results you want without having to change your workouts or diet or buy a ton of supplements. My solution is beyond easy. You can have beautiful skin and hair, restful sleep, lighten your periods, lose weight, feel calm and light, improve your libido and vaginal health, and improve your health long term. Let's get into why what you're doing isn't working and the surprisingly easy way to fix it. Women start to have a lot of aging concerns after the age of 30, 35. Then they spend a lot of time and money on supplements, medications, diets, programs, creams, serums, injections, and even medical procedures. And because women are led to believe that they need a treatment for each individual symptom, or that each problem is completely unrelated to one another, women end up trying dozens of different products. They spend on average $12,000 a year trying to feel better. They are told that they need one thing for their anxiety and then a separate solution for their insomnia, and yet another for their low energy and another for vaginal dryness, and then a serum for their hair loss and injections for wrinkles and another injection for weight loss. And then they need to lift weights, really heavy weights, and don't forget to eat more protein than humanly possible, and creatine too. Then they are told that they need gut supplements, diet restrictions, and not to mention the multiple cups of coffee to battle the brain fog. It's frustrating, I get it. There is nothing more disheartening than trying everything, spending money, and not seeing hardly any results. And women have been conditioned to believe that we need a separate treatment for each concern that we have, that our hair loss is unrelated to our irritability, and our low libido is unrelated to our weight gain. Women have every single company marketing a solution to them that can solve all of their problems. No wonder nobody really wants to figure women out. They're too busy profiting off of them. But what if I told you that all of your symptoms, insomnia, irritability, weight gain, hair loss, gut health, high cortisol, brain fog, and everything else are most certainly related? And not only related, but all caused by the same thing. And that this single thing is also the secret to unlocking optimal health, unlocking optimal mental, physical, and emotional well-being. That is the foundation to aging well and feeling great while you age. Maybe we can even slow this aging process down so that we can be healthier for longer. In the longevity space, this is called health span. And you can do it without spending a fortune on supplements, creams, serums, injections, or medical procedures. This is the life that you want and deserve, to feel absolutely amazing as you age. And my solution is also natural, holistic, and something that we naturally did when we were younger. You're going to be shocked at how fast your body changes and how easy it really is. I mean, don't get me wrong, you have to age. But feeling terrible isn't a required part of it anymore. All of the symptoms of aging, optional. The symptoms of perimenopause or even menopause, optional too. Feeling younger and happier again and getting that ideal look in the mirror is actually so much easier than you think. I feel for women these days. They have multiple symptoms starting at age 30, but it's usually fatigue, gut, or weight gain, stuff that can be attributed to something else like lifestyle. Oh, you're just tired because of your kids, or you just need to eat differently. So women just work harder to make these changes. And when they finally seek help, they are told by doctors that feeling terrible is just a part of aging and that they should accept it. That being in pain is just part of being a woman. Being gaslighted by doctors that everything is normal despite knowing that your well-being and health are declining is flat out demoralizing. They are also told that their hormones are normal because they're still having a period. or that they shouldn't do anything until their period fully stops for 1 year. Women feel hopeless, that they have to suffer, and that there's no help. Women are also incredibly confused about what is going on and what to do. With all the conflicting information out there, women become paralyzed and end up not doing anything, or they just stick with supplements that don't work. Now, you're still listening to me because you want to feel the best that you have ever felt in your life. You want to come home at night and have energy to go to the gym, spend time with your partner and kids, have beautiful skin and hair, sleep restfully through the night. And how about burning fat and building muscle? And you want to get rid of this new anxiety or depression, or stop being irritable with everybody that you love around you? And you want to have healthy and satisfying intimate experiences too. And these are all exciting goals. And believe it or not, it's super attainable. And not only can women have all of these things, but they can be healthier as they age too. Prevent heart disease, dementia, muscle aches, diabetes, osteoporosis. So stick with me for a few minutes, because by the end of this video, you're going to learn an unbelievably easy way to have all of these and even more than you thought of. Mental clarity, better mood, sleep, skin, hair, and libido. You can feel better than you have ever felt. You can feel better than you have felt in a long time. And maybe even better than you felt when you were younger. Women tell me that after implementing my approach, that they even feel like they are aging backwards. I'm here to give it to you straight. I will break down why you're having all of these symptoms and how they are caused by just one thing. That's it. I will make it so easy for you, and you'll also learn that you have more control than you think over how you age and how well you feel as you age. And don't worry, it isn't anything that you did or are doing that is causing you to feel this way. It is biology. It's simply aging. Women are living until 90, but we were never meant to live this long. So how do I know all of this? My name is Dr. Sarah Daccarett. I'm an anti-aging expert, hormone and peptide specialist, board-certified physician, and creator of one of the best-selling hormone replacement therapies on the market today. And I've had the privilege of sharing my secrets with thousands of women already. I have gotten to watch the results and benefits firsthand as they have made incredible transformations and have gone from feeling miserable every day to an absolutely life-changing alteration by only changing one thing. Not only have I seen thousands of women undergo this incredible transformation, but I have experienced it myself. In my mid-30s, after the birth of my son, my hormone levels never recovered back to pre-pregnancy levels. I refuse to feel this way. I refuse to just be tired, have terrible hair and skin, gain weight, and live like a zombie the rest of my life. My immune system was so low, I got sick all of the time. I had to restrict my diet. I couldn't eat anything. I dieted and still gained weight. I was irritable with my partner and my new baby. I had anxiety. I couldn't sleep. I mean, you name it. I tried everything, literally. Dietary restrictions, supplements, lab tests. And when I finally realized it was my hormones, I realized that I had no training from medical school. And I thought, man, if I'm a doctor and I'm struggling, how are women in general coping? One thing that I learned is that I wasn't alone. In fact, the vast majority of women start to experience some signs of aging after the age of 30. I mean, this isn't going to surprise you. You've been feeling like things have been going downhill every year since the age of 35 or so, right? I mean, wrinkles, dry skin and hair, weight gain, forgetfulness, fatigue, moodiness. And each woman is impacted differently by this. But some get major digestive problems. Some get autoimmunity. Others get ADHD-like symptoms, or endometriosis, or polycystic ovarian syndrome, or infertility. Some get leaky gut, or high cortisol. A few rare lucky ones fly through their 30s without much. And by the time women get into their 40s, most women are experiencing debilitating symptoms like worsening anxiety, short temper, insomnia, brain fog, hair loss, low libido, low energy, and even vaginal dryness. So you're probably dying to know what the one common thread is for all of these symptoms. I mean, how can irritability, insomnia, anxiety, brain fog, autoimmunity, poor digestion, weight gain, inflammation, insulin resistance, wrinkles, dry skin and hair, leaky gut, high cortisol, and acne all have the same root cause? And just to be clear, leaky gut is not a root cause. It is a symptom. Insulin resistance, not a root cause. It's a symptom. High cortisol, also not a root cause. This is a symptom. The root cause of all of these problems is low hormones. That's right, low progesterone, low estradiol, and low testosterone. Every year as we age, hormones drop off by a percentage. And for women, this decline starts at age 30, not at age 50 like we have always been told. So even if you're still making some hormones, it's not optimal. And that's when you start to see your health decline. And yep, your period can be completely normal and you can have very low hormones. I repeat, just because you are still having a period doesn't mean you are making enough hormones. And this is actually really great news because it means that if you simply enrich your hormones and you replenish them, you can potentially treat multiple symptoms, feel better, age better. And it also means you actually do have control over your health, even though right now it feels like you don't. So how does progesterone, estradiol, and testosterone seemingly do it all? It's important that women realize that hormones are the CEO of the body. They regulate and manage every process. And when they're absent, nothing functions quite right, and aging is accelerated. Take your gut, for example. Constipation, bloating, food insensitivities, leaky gut, and fatigue after eating can all happen with low hormones. And this is because both estradiol and progesterone keep your digestion healthy. They keep the gallbladder and motility functioning. They improve blood flow and mucin production. And they influence the microbiome to make sure that it's diverse. They also keep the tight junctions tight by enhancing zonulin, which is the glue in the intestinal wall. This prevents leaky gut. So if you are chasing your diet all day just to feel better, and you have so many dietary restrictions just to feel somewhat normal, and if you stray from your diet at all, you pay for it, this is a sign that you have low hormones. And what about your skin? Do you want radiant, glowy, firm, hydrated skin? Prevent wrinkles, aging, and acne? I know I do. Estradiol and progesterone keep the skin so healthy and vibrant. It's like the best anti-aging secret. And the best part is, no needles. Estradiol boosts collagen, elastin, and hyaluronic acid. It also increases the turnover of cells, which prevents wrinkles too. It also prevents age spots and acne. Estradiol also keeps the skin hydrated and radiant. That is why when estradiol is low, skin, hair, mouth, eyes, ears, and the vagina all get dry and itchy. Yes, itchy ears and dry eyes is a thing. And when the mouth gets dry, women get more cavities. Estradiol is important. It's very hydrating. Progesterone reduces inflammation, sebum production, and prevents DHT from being formed. DHT is the hormone made from testosterone that causes acne, oily skin, and hair growth on the face. And what about hair? Estradiol stimulates the growth of hair follicles, and progesterone prevents the hair loss by blocking DHT. The amazing thing is that when you supplement back in estradiol and progesterone, you start to see results with your skin and hair within 3 months. And what about sleep? Are you waking up at 4 a.m.? What about irritability? Moodiness? Notice that you're short-tempered or just not patient anymore? Progesterone is a woman's main hormone. In fact, it's the primary, most abundant one. Progesterone and its metabolites bind to GABA receptors, which act like a benzodiazepine, treating anxiety and irritability. And sleep is a game changer for all of us. This alone impacts so many women, and this alone is reason enough to supplement hormones. Both estradiol and progesterone increase GABA activity, maintain body core temperature, increase melatonin synthesis, raise dopamine and serotonin, and prevent early morning rising. We know that increased dopamine leads to increased REM sleep, which plays a role in how we remember things and how we process emotions and dreaming, which means that when you replenish these hormones, you'll fall asleep, sleep through the night, and dream because you're going to be in REM. Another thing I hear all day long is that women are told that their cortisol is elevated, and that is why they can't sleep and lose weight. High cortisol is not a root cause. It is a symptom. And low hormones are also the secret root cause of elevated cortisol. Estradiol and progesterone keep cortisol in check. Women spend a lot of time trying to lower their cortisol, not realizing the real reason it's elevated to begin with. Estradiol actually keeps cortisol at normal levels. It prevents the adrenal glands from overproducing it. Progesterone competes for the cortisol receptor, which means that progesterone calms the stress response. If you have elevated cortisol, it's likely because your estrogen and progesterone are low. We're supposed to have stress. Stress can be a good thing, and we should be able to handle this stress. If estradiol and progesterone are present, Your cortisol shouldn't get crazy high because you're stressed or working out too much or drinking coffee on an empty stomach. You should be able to do all of these things: work out, drink coffee, and be stressed. I mean, you've already been trying all of these things to lower cortisol already, and it's not getting you anywhere, right? Because you aren't addressing the root cause by lowering cortisol. It is simply a Band-Aid fix. And what about brain fog? Can't concentrate, remember anything, or focus? Are you even motivated to go to the gym? All three hormones, progesterone, estradiol, and testosterone, boost dopamine, acetylcholine, and norepinephrine. They improve blood flow in the brain, reduce inflammation, and help your brain repair. So when your brain feels sluggish and you feel overstimulated and anxious, you are likely low in all three hormones. Are any of these things starting to sound familiar? Is it becoming more clear how you can be feeling like you're going crazy, trying to treat all of these things as individual things when they all have the same root cause? There's another thing that happens to women when hormones are low, and it has to do with her immune system. Now, women have a complicated immune system, and it's so that they can carry a baby, which is a foreign object, for 9 months without the immune system attacking it. It also has to be strong so that she can fight an infection while she's pregnant. So during pregnancy, a woman has to have a very strong immune system that is highly regulated. And this is remarkable that the body can do this. And estradiol and progesterone are what do this for her. However, when these hormones drop and are really low, this is when you can see all kinds of problems like autoimmunity. This is why autoimmunity is 4 times more common in men than women. Women also get skin rashes, increased sensitivity, increased histamine, and eczema as they age. And women also find that as they age, they can easily get more sick during the winter months too. All you have to do is ensure that your estradiol, progesterone, and testosterone levels are sufficient, and you can keep your body healthy. I mean, it will literally change your life, and you'll be able to sleep, have beautiful hair and skin, lose your weight, reduce skin rashes, relieve dry, itchy eyes, relieve your itchy skin and ears, lower cortisol, have mental clarity and motivation and energy. You will have a great mood, outlook, and even life. So how do you do it? Well, my solution takes just 10 seconds a day and is beyond easy. I tried every hormone replacement option there was. The best-in-class approach. I tried it. Every combination and dosing possible. And you know what I learned? That all of the current formulations we have for women are very ineffective. They have low bioavailability, which means they don't absorb into the body very well. They have a lot of side effects. And this is because of the way the body metabolizes the form. And I learned that none of them were meant to make a woman in her 30s or 40s or even 50s feel youthful and vibrant, the way that I was determined to feel. These other current formulations, these cookie cutter formulations, are designed to treat one symptom at a time. Nothing is designed to stop all symptoms. And it turns out that the options that women have for replenishing hormones is very limited and outdated. There has been no innovation in this space for decades. Women's options are so ineffective that they have to combine multiple different products together to cover only a fraction of their symptoms. They have to use an estradiol patch to prevent hot flashes, and then add on a vaginal cream to treat vaginal dryness, then oral progesterone for sleep, then a testosterone cream for libido, then an estriol cream for the face for wrinkles. I mean, that's 5 different hormone products. And on top of this, they still have to take hair loss supplements, weight loss treatments, vaginal rejuvenation procedures, and 100 other things along with their HRT just to get the basics covered. Not to mention the multiple cups of coffee to battle brain fog. I mean, if you have to combine all of these solutions and you're still not feeling better, then they aren't really solutions, are they? If you want beautiful, youthful skin, hair, mood, libido, body composition, energy, and even ultimate disease prevention, you won't get it from the other outdated formulations. I promise you this. That is the secret I'm going to give you today. The solution I created when I refused to accept the status quo is now how I feel better than I ever have felt before, and even better than when I was younger. And you can do it too. I guarantee it, actually. And I will tell you how. I have been sharing this secret for years in my clinic with women, and now I want to share it online so that every woman can experience it. Now, I know what you're going to say, that your doctor told you your labs were normal. Many of you will even say that your estrogen was high, or you were told that you have estrogen dominance and it is the root cause of your problems, or you've been told that estrogen is dangerous and causes breast cancer. Wow. And I have heard all of these things too. And estrogen really has gotten a bad rap, the worst actually, and for no good reason. Let's quickly get into these misconceptions and why none of them are based on science, but only on fear. Your doctor told you your estradiol was high, so you don't need it. But you have all the symptoms and problems that I described earlier. Your estradiol maybe even was, let's say, 1,000 picograms per milliliter. The problem is that this is only one point in time, one measurement. When the ovaries aren't working as well, the brain releases a hormone called follicle stimulating hormone, or FSH. And FSH stimulates the ovaries to make estradiol and progesterone. And when the ovaries are struggling, the brain releases even more FSH and more. And finally, the ovaries are able to make some estradiol, but not always make progesterone. Or the adrenal glands are able to make testosterone, and then this converts to estradiol. So you can have an estradiol of 1,000 picograms per milliliter, but that doesn't mean that your estradiol is always that number. It just happened to be that high when you got the lab. The better test is the FSH test. If FSH is elevated, then that means your body is struggling to make hormones and the brain is trying to stimulate it. And since doctors don't learn about hormones in medical school, virtually no doctor, not even hormone specialists, take advantage of this test. If your FSH is above 9, your body is struggling to make all 3 hormones, no matter what the level happened to be the day you took the test. Another reason why an FSH is the best test to diagnose perimenopause or low hormones, and it's a better test than the absolute level of hormone, and I'm talking about urine, blood, and saliva tests. All of these tests, none of them have appropriately established optimal reference intervals for estradiol and progesterone, only testosterone. Labs don't flag low estradiol, so even an estradiol of 0 or 20 is considered normal. And the upper limit of 400 picograms per milliliter, this was established on 49 women only and over 100 men. That means when your doctor tells you your estradiol of 100 is normal, or that a value of 440 is elevated, there is not a lot of great science and research behind these statements. You're also being compared to only 49 women, and who knows if those 49 women were in optimal health, or the health that you want to be in. And doctors barely even order progesterone, and when they do, there are no optimal reference ranges established for progesterone. In fact, there are only 5 research papers in the whole world that address optimal reference ranges for progesterone. Bonkers, right? It is so much better to treat based on your symptoms. And if you're concerned, you should follow an FSH. If an FSH is elevated, you need hormones. And if it is suppressed, meaning it's less than 1, then your hormones are too high, or the dose of hormone that you're taking is too high. I also hear all the time that women still think that estradiol causes cancer. In fact, 50% of women believe this, and that is dangerous, and that estrogen dominance causes cancer. I talk to women all day long that know something is wrong. But then too many times I hear women say that they're waiting until they are sure they absolutely need to start something. I assure you that things just get worse the longer you wait. You deserve to feel better now and get the life and the body that you want and deserve now. Women take no action because they're frozen with all the misinformation. In this case, taking no action is harmful. Low hormones cause health problems and impact your life, relationships, health, and well-being. Women are worried to start because they may have to take it forever. But this is a good thing, that women have an option that they can take forever, that there is a solution that can make you age really well and feel great while you're aging, that we don't have to suffer like our generations before us did. Why would anybody wait to feel better? If you don't like the way that it makes you feel, you can simply stop and go back to what you were before you started it. So what are the secrets to hormone enrichment or replacement? What is the secret to getting it right? One secret for women is that progesterone is a woman's main hormone. And another secret is that progesterone converts to testosterone. That's right. This is a huge way that women make testosterone, which is a good thing. It's great for women to have just the right amount of testosterone, but not too much. And I'll get into what happens when you have too much. Another secret is that the ratio of all the hormones to one another is critical. Progesterone to estradiol to testosterone. And when the ratios are off, you don't feel like yourself. Current treatments are ineffective at getting this ratio right for women, which is why they don't seem to work. they're also really bad at getting testosterone just right. Usually it gets too high and causes side effects for women. So let's get into why all the formulations currently don't work and how my solution is potentially better. One very popular hormone option is oral progesterone. Now, when you swallow a pill, it gets metabolized by the liver first, before going into the bloodstream. This means that the liver will break it up into chemicals called metabolites that are completely different from what you swallowed. And when it comes to hormones, 80% of the hormone is broken up into metabolites. 80%. Oral progesterone only has a 20% bioavailability, meaning your body can only use 20% of it. That means that your 200 milligram oral progesterone pill is really only 20 milligrams of progesterone. And the rest? Well, the other 80% is what causes all the side effects. The other 80% turns in metabolites that just make you sleepy. Now, this can be nice because it's a great sleeping pill. But the problem with this is that it makes you sleepy during the day too. I mean, progesterone doesn't naturally make women sleepy. I mean, think about it. 18-year-old woman would be falling asleep while driving during the day if this were the case. Next, let's discuss the problem with topical creams, which are also very popular. Topical creams can be progesterone, estrogen, testosterone, maybe they can be estradiol, estriol, or any other combination of these. The skin, the outer skin, is a barrier. It's meant to keep stuff out of the body. And even with a base that increases permeability, only a small fraction of the hormones absorb into the bloodstream. So a topical cream, just like an oral pill, has about 20, maybe 30% bioavailability, meaning your body can only use 20 to 30% of it. So what happens to the rest that doesn't absorb? It gets all over the house. Kids, partners, pets, bed sheets, towels. Now I know what you're thinking, but these physicians have told me that it completely absorbs, and it absorbs immediately. That's a complete lie. I've seen it happen hundreds of times now. Just to put this into perspective for you, we used to give men testosterone cream. And even though it's still available, it is largely not prescribed because we saw how it contaminated everything in-house. It put children and women at risk. So why would we keep doing HRT in such an inferior way like a topical cream for women? Because until now, we didn't have a more innovative solution. And I'm excited to tell you about a more modern approach. But first, let's talk about pellets and injections. Now, the problem with these formulations is that progesterone is an afterthought. Typically, physicians only give testosterone and estradiol pellets and injections. Sure, I mean, testosterone is important, but it is easy for it to get too high with a pellet or an injection. And when it's too high, there are a lot of side effects, like weight gain, bloating, constipation, irritability, and hair loss. And once the pellets are in, well, you just have to wait until they wear off. I have seen countless women with pellets or who are injecting testosterone. And yes, they're able to gain some muscle and they might get some energy, but a lot of them just gain weight and get bloated and irritable. And yes, it can give you that teenage boy libido, but it also gives you the acne of a teenage boy too, if that's what you're going for. But most women I talk to don't actually like feeling like a teenage boy. They want a more open, receptive, natural libido that estrogen and progesterone offer. Testosterone and estradiol are naturally different in the roles that they play in libido. And estradiol and progesterone play a bigger role in libido for women than they're given credit for. And if women think they're getting a cognitive boost from testosterone, can you imagine how much better the boost is from the other two hormones? Women who only take testosterone have no idea what they're missing. The other two are even better, if you can imagine. So women are being misled about this, that they need so much testosterone. Women are not tiny men. Testosterone plays a role, but not a primary role in women. And if it gets too high, there's going to be a lot of side effects. And it's actually very easy to get it too high with injections and pellets. So do you want to know the secret way to raise testosterone levels naturally without the risk of them getting too high and having side effects? Women convert progesterone to testosterone. That's right. She can make exactly what she needs from her primary hormone, progesterone. This way, we can be like Goldilocks. Not too much and not too little, but just the right amount of testosterone for her. This is very personalized. So now you know. You are feeling terrible and you have hundreds of symptoms because your hormones are low. So now you already know that if your hormones are in the optimal ratio, you will easily feel your best. You'll lose weight, you'll get rid of the bloating, you'll stop hair loss, boost your mood, make your skin glow, have restful sleep, and treat dryness, all within just a few weeks. But how do you do it? And you also know that the other various problems with the outdated formulations. But what about looking at the problem in a new way? from a female physician who has been through it all and has already treated thousands of women. This is game over. You get started with us and people will be asking you what your secret is in no time. And over time, you will feel you are aging backwards. The longer you do it, the better and stronger you will feel. I can promise you that. So let me introduce you to Oestra. It is a complete hormone enrichment product. It is your one-stop shop for feeling like you used to. It just became your new non-negotiable. So here's why Oestra is such a game changer. It's easy. First, Oestra is custom, arguably the most custom product on the market. This means that you can start at a low dose and go up as fast or as slow as you'd like to, or you don't have to go up, and you can end up on the dose that is perfect for you. We send a starting dose that you can adjust yourself. That's right, nobody knows better than you how you feel. You can start with a quarter of a pump, a half a pump, or a full pump. We can raise it after a while based on your results. Most women find that the starting dose is a good place to start, but you can choose to start lower by just doing less cream. And if you don't know what to start with, our experts help guide you. Aside from making it as easy as possible to adjust the dosing to make it highly personalized, most doctors and online companies leave you with some cookie cutter regimen. Even if they tell you that they're making adjustments based on labs, they are still only giving you set manufactured products that are far from personalized. These manufactured products are made for women who just want to stop hot flashes. They're not effective at treating all the symptoms of menopause or perimenopause. And they don't treat endometriosis, PCOS, or make anybody who wants to feel incredible, incredible. I don't want you to settle for these ineffective products. I am not going to waste your time with products that don't work, period. And the best part is, like I said, you have more control over your dosing so that you can make adjustments with the help of our experts, making Oestra super custom and tailored to you. Second, Oestra has 4 times the bioavailability compared to oral or topical delivery of hormones. 4 times. Vaginal delivery is a game changer. Superior hormone delivery is one of the many reasons why vaginas are a woman's superpower. The vaginal mucosa is a perfect way to get a drug or hormone into the bloodstream. Now, we can get nearly the same bioavailability as an injection without having to do an injection, no needles. Now, I know you've heard that vaginal delivery isn't systemic, but that is only because the doses that are used in traditional vaginal estrogen creams is so very, very low. It is only enough to help with vaginal dryness. But the vaginal wall is very absorbent. And the best part is, your progesterone, estradiol, and testosterone all fall into optimal ranges and in the right ratio to one another, with progesterone being the highest, most abundant hormone. Another reason Oestra is a game changer, we use an FDA-approved base that is made specifically for vaginal tissue. We want to preserve the vaginal microbiome, maintain an acidic environment, and not irritate or burn this sensitive area. Other manufactured vaginal creams have a reputation of burning. Not Oestra, I can promise you that. Estradiol and progesterone are so important for building collagen, elastin, and hyaluronic acid, and they also improve blood flow, lubrication, prevent urinary tract infections, yeast infections, and urinary incontinence. Every woman deserves to have exceptional vaginal and pelvic health as she ages. This is a critical part of women's health, and Oestra works exceptionally well. In my opinion, knowing exactly what else is out there and has tried everything else, our clients tell us all the time how happy they are with the improvement in their relationships and satisfaction in this particular area.
I absolutely adore Imbalance. I started it because I was almost 40, and I'm now 40, but almost 40, a mother of 3 kids, and just had like the brain fog, the exhaustion, like just crazy brains, all kinds of things. You're like, what is going on with me? I don't get this. Sometimes you're like hot, and I feel amazing. It's been 6 months now. Like even my face is getting better. Look at that. Bounce in my cheeks. Like it's freaking phenomenal.
And I turned 40 recently. I was having trouble sleeping. I was having itchy palms. I was having a lot of symptoms of perimenopause. So it definitely was a hindrance to my life. So ever since starting Oestra, my periods have gotten shorter and lighter, which is really great. I also have way more good days than I do bad days.
I really feel like this has been a gift to my health. After years of struggling with low energy, fatigue, mood swings, all of the perimenopause symptoms that I was introduced to, I came across Imbalance and was wanting to give them a try for my health. And my creativity has come back, my brain fog has lifted, I feel more energetic, more level energy day in and day out, and I just have felt so grateful for the opportunity to work with a hormone replacement therapy that is just accessible, easy to use, and really comes with some significant health benefits.
Now, I bet you're wondering, this is a vaginal cream, and now I'm going to be closer to my partner that I'm feeling incredible, so don't I have to worry about getting it on my partner? The short answer is no. And this is because the absorption is so good. As long as you wait 1 hour before intimate contact, it'll be okay. Now, on the other hand, topical creams, when you place them in between the thighs, for example, this is a huge risk for contamination to partner because only 20% of that topical cream absorbs and the remaining 80% has to go somewhere, and that's usually in the bed sheets, on partners, and towels. And if you need another reason why Oestra is a game changer, it is made in a 503B FDA-regulated pharmacy. This means higher levels of inspection, regulation, quality control, potency testing, and guaranteed consistency. Very similar to what you would find in a manufactured product. Now, most companies online will just sell you a one-size-fits-all hormone, cookie cutter variation of a patch, an oral progesterone pill, or a low-dose vaginal estrogen cream, and that's it. No help balancing or adjusting or anything. At Imbalance, we give you unlimited expert support online. The other companies, they just leave you hanging. And you can reach us through our secure communication lines from the comfort of your own home. Our experts have worked with thousands of women, and they will even give you supplement advice if you ask. This is completely optional. You don't need supplements, and you don't have to buy any extra supplements. But we do offer it simply because a lot of our clients ask us. What I'm saying is that we're here for you every step of the way through this. We don't stop until you feel your best. I know, it sounds too good to be true. A cream that does it all? It raises all three hormones, progesterone, estrogen, and testosterone, into the right ratio at optimal levels, and you can do it without having to combine 3 or 4 different products, and it's shipped to your door, prescribed by a board-certified physician, and made by a 503B regulated pharmacy? Oh, I assure you, it's all true, and I promise you it is as good as it sounds. Now, I bet you're asking, how do you know how much to give me? Well, you are low now, and I would want to get you higher than you are now, and in the right ratio, so that most of your symptoms stop, and we can do this with just a starting dose. Now, this starting dose works for most, but if it isn't right for you, our experts can help make adjustments. The vast majority of women usually want to go up from our starting dose, and I have found that women don't do well when you just give them one hormone, just progesterone, or just testosterone, or even cycling it just 2 weeks of the month. This is not personalized medicine. It is just under-treatment of women. The only way to truly personalize hormone replacement therapy, I mean truly personalize it, is to get on a starting dose and then see what your body does. What happens to you? Do you have symptoms? Breast tenderness, bleeding, bloating? Then we know what your body is doing and we can make adjustments based on that. How fast is your body metabolizing the hormones? Is it slow? Is it fast? Are you making too much testosterone from the progesterone? We won't know until you get started. Then, based on your symptoms, we can either go up or down or start a supplement to help you balance it out. Labs almost always end up being normal. Yet, you can still have problems, and no lab test can predict how your body will react when you start hormone replacement therapy. Now you're thinking, this must be expensive. So let's talk about the price. If you were to see a hormone specialist, they typically charge anywhere from $1,200 to $6,000 just to walk in the clinic door. And that isn't covered by insurance. And that doesn't even include the cost for all the labs that they're going to want to get on you. Pellets easily cost $300 to $700 a month, and that doesn't include oral progesterone or labs. Oestra is $199 the first 6 months, and this includes the custom cream that can be personalized as you go, as well as unlimited expert support. This is 20% of the price that you would pay to see a specialist in a clinic. And the best part? After 6 months, it is just $99 a month. That means you can feel your best for less than the price of a latte a day. Because of how confident I am that you are about to experience some life-changing results with everything I just mentioned, we offer it completely risk-free for 180 days. If for any reason you don't enjoy feeling the best you've ever felt, no problem. Just shoot us an email or text and we'll give you your money back, and there will be no hard feelings. This means that you can try it for a full 6 months and then decide that you don't like it for whatever reason, and we'll give you your money back. No questions asked. And one of the greatest things is that you don't have to pay and then wait months to see a specialist, get labs, drive to a pharmacy. None of it. We have made everything so it's available in your hands in less than 5 days from now. Right now. Shipped directly to you. So you can get near immediate results now. All you have to do is click the button below to get started. Now I know that this formulation of vaginal progesterone and estrogen works, and so do the thousands of other women that have made it life-changing transformation by simply putting a pea-sized amount of cream on daily. So if you're serious about turning the corner, feeling better, showing up better, so that you wake up excited to be alive, then make today the day that you took a stand, the day that you can look back on, the day that it all started. Take advantage of this offer and get the life and body that you have always wanted and deserved. I have made it no longer confusing or overwhelming. With Oestra, we have made it so simple, just 10 seconds a day, just one product from the comfort of your own home. No labs, needles, or pellets, and a custom-made, super personalized way to do HRT that can't be found anywhere else. Well, if you're still here, that means you're probably still on the fence. So let me leave you with this. You have 3 options. 1, you can keep doing what you're doing before you watch this video and you can keep getting the same frustrating results that led you here. Or 2, you can take all of the pearls of wisdom that I have given you about hormones and try to do it yourself. You can spend the hours it takes to find the right specialist that isn't afraid of hormone therapy and is knowledgeable in balancing and ratios, labs, therapeutic levels, and supplements that are needed to make sure you don't have side effects. And you can then spend weeks or even months in some cities to get into a specialist. Then spend hours in traffic, lines, and filling out forms in the offices, and then getting panels and panels of overpriced, unnecessary lab testing. And you can then pay these specialists thousands of dollars and hundreds of dollars in lab fees to then be undertreated. Or worse, told that you only need one hormone like testosterone and nothing else. Or maybe they'll even only give you hormones for 2 weeks out of the month. And for those who don't live in a city with a specialist, you can go to your PCP and OB-GYN, only for them to tell you that they won't test, that you're normal, or worse, they will tell you that hormones are dangerous and cause breast cancer. But you might get lucky and find someone who will prescribe you some vaginal progesterone and estrogen, and you can try to get it covered by insurance. But in general, insurance doesn't cover something like this. And not all insurance companies deem the treatment of perimenopause and menopause medically necessary. And most formulations are $250 to $400 out of pocket for vaginal progesterone. And that doesn't even include the estradiol. Or 3, you can drink coffee at home for a while, or choose to eat at home rather than going out to eat once or twice a week for a couple of months, and use that money that you will save and make this so easy on yourself and become the best, healthiest, happiest version of yourself. If you truly want that, then let today be the day that you decided to take this offer. You've got everything to gain, and thanks to our guarantee, you have absolutely nothing to lose. So you can either keep chugging along as you are right now with zero promise of results, or you can try Oestra and finally achieve what you deserve. Just click the button below this video to get started now.